topic for us lately. We're in the final stages of, we've been preparing it, and one of the big things that I've had to do as chief deputy is to hear from the providers who work with the different service areas around particular programs that might have been at risk because of budget shortfalls. We learned that we became very popular within the county because we had resources, and we committed many of those, especially the prevention and early intervention resources, in a way that might not have made the most sense. So we were talking about downsizing some of those, but some of the programs that I'm happy to say did not wind up on the chopping block are SB 82. These are our outreach teams that you'll hear more about from a colleague in a moment. Another topic that's been big in the news lately are the unions. Some of you who follow news media may be aware of the Janus decision, which came down that limits the way that unions can require employees to pay dues. We know that in California there may be still some protections around that, but we're still continuing to work with the unions carefully despite this change. We'll always be willing to take their input, and we're in the starting stages of negotiations with the unions for the upcoming year. Unfortunately, our meeting yesterday with the CEO was canceled. Unclear why that happened, but we're ready to give their input whenever we can. We're also in the process of, throughout the county, remodeling clinical services. Dr. Ruskin alluded to problems with access. It's no secret. I don't think a day goes by in my office that I don't learn about someone who's not getting the care that they need in a timely way. And we try to address those carefully. Dr. Roderick Shaner, who some of you know as the former medical director, who's now serving as the Office of Policy Management Director, is working as a portal person. Some of you have worked with him around identifying some of the links that are not as strong in our system as they need to be. But these remodeling process will involve access, scheduling that's centralized, and also having real-time ability for clients to be able to use, say, a smartphone app to schedule appointments to see their doctor, to be able to communicate with their healthcare providers. It's really moving us into the millennium as a department. We're also looking at expanding our services using advanced practice nurses. Someone that I'm working with now is a former board deputy, Flora Gill-Krisaloff, who herself is a nurse practitioner, to help us understand better how we can involve and enrich our services through using NPs. Someone asked earlier about SB 1971. I will say that SB 1971 is a Senate bill at this point that is moving quickly and rapidly through the process. It is about grave disability and redefining it. Currently, grave disability is defined as inability to provide food, clothing, and shelter. The modification would include inability to provide for one's medical care where it might result in some continuing deteriorating condition. And our intention initially is that it's for someone who's facing a life-threatening illness or loss of limb because of inability to take care of themselves. I will say that Dr. Sharon and I both have gone to Sacramento. I testified before the Health Committee, he testified before the Senate Judiciary Committee, and despite some challenges, it made it through. We feel that this is a start, and we're now trying to work with both disability rights as well as with the advocate Daryl Steinberg, who some of you know, to make sure that we get it right. Because right now the bill has some modifications that could result in it not going very well when it gets implemented on the streets. So we do have an opportunity, because I've heard that the governor is supportive of it, of getting this passed and getting some of those folks who are in the most vulnerable. I think of them as being the tri-morbid, who have mental health problems, substance use problems, and often physical health problems. They're the most vulnerable, and we need to devote services to them. One concern is, where will these services be delivered? My view is that they don't need to be in a locked facility. In fact, we're talking now about expanding our conservatorship capacity, and unfortunately, it's not just about creating more positions, as someone pointed out, it's recruiting someone to serve in those positions. Right now, the conservatorship office or public guardian has open spots, probably close to 40. So we could put 40 more spots there, but that doesn't result in more bodies. What we need to do is work towards reclassifying some of these positions so that they're compensated at a better rate, so that people are willing to stay in those positions for longer and provide services as they become more experienced, rather than leaving to another kind of department. So more on that. Another point, just to update you all, I believe in full transparency. Diversion 50 was a project that was started by then Supervisor Yaroslavsky. I believe that Flora was his deputy at the time, Flora Gill-Krisaloff, who I mentioned earlier, and this was in District 3. And it was basically a program that would divert people from going into the criminal justice system, meeting them at the courthouse before the judge makes a decision that you're going to be sent to an incarcerated situation to divert you to community treatment. That program is far too small. I'm sometimes amazed that when I left the county almost 8 years ago, it was only about a dozen people. Now I think it's maybe 14. I think every courtroom in Los Angeles should have someone who's there who's an advocate to keep people from ever entering jail in the first place. So Dr. Sharon is committed to doing this, but we learned from the district that their discretionary funds, which have supported it generously for the past couple of years, will no longer be available. We are looking at other resources that we might have to support that program because we think it's very important, and meeting with our colleagues at the Office of Diversion and Reentry to work on that. A few other quick news updates before I hand it off. The Charles Drew Residency Program, which some of you know I've had some history with. I am still serving as the department chair until I step down. I've submitted my resignation for the end of this year, but I wanted them to get off the ground. 6 new psychiatry residents who are fully funded by the health agency through the Department of Mental Health have started their orientation. I met with them on Monday to talk about physician wellness, because they can't take care of other people if they don't take care of themselves.
That's right.
Reba told me that she met with them at Kedron. So they're off and running, and this is a program that's really going to be community-based, a part of their orientation month, because that's a generous time to get them to know not just about where the bathrooms are and how to write notes appropriately, but to go on tours in the community so they get to meet with people. There's a program called Walking with the Doc that's been done in some communities very successfully, where they'll be able to meet people in the community, talk with them in real time about their concerns, and learn what their needs are. Another update, some of you attended We Rise during the month of May.
Yay.
I don't think we've been back since that happened. For those of you who didn't make it, it was an art exhibit, but also much more, a multimedia event that went on for a month plus a week. During that course of time, 18,000 people attended by the last week, and 3,000 school children had attended. This was a prevention program in the rarest form that had a lot of social media attention, phenomenal art, phenomenal conversations, poetry, music. It was really the whole tamale. And it was extended for another week, and we did have an SLT meeting there, and hopefully you all got to see it. Striking this morning, I was at the gym, and I saw a young man in his 20s wearing his We Rise shirt. Not the typical person who you think of being an advocate for mental health. I was able to engage him in a conversation to find out, how did you learn about it, how did you go there? So these are the people that we haven't always reached out to successfully. Another group, athletes, the Sparks, held their first Mental Health Awareness Month and Day this past week. I was able to go and meet with folks who had just done yoga on the court to talk about mental health in particularly communities of color that are an area of knowledge for me, and how they can access services. So kudos to the Sparks. They're a women's basketball team, and they're doing really well. I met with ACSA, the Association of Community Health Services Agencies, their leadership yesterday. Some of the concerns they brought up that were really important to me is with the reorganization, where do children's services fit in? Typically, children's agencies are outside of the department directly operated clinics. I made a commitment that we will look at that more carefully. And also they brought up a concern about where does the community health center fit in the reorganization. And it's still critical and important to our mission. We need to partner with not only our directly operated clinics, but the legal entities that we partner with as well. I think another question that they raised was authority and reporting lines with this reorg. So I did make a commitment that once we get everything aligned, we will have duty statements and people who are responsible for different things. I will bring that information back to the commission so that you all understand that too, because it has been dizzying, all the change. On a sad note, we did have a couple of high-profile suicides from celebrities this past month. Kate Spade and some of you know Anthony Bourdain both died by suicide. The department partnered with the Department of Public Health to get messages out. Unfortunately, the suicide rates in LA County have gone up over time slightly, and it behooves us to do more public outreach about that. So we are doing some joint messages with health services and public health when appropriate. So I'm going to pause there, and perhaps later we'll have questions, but 2 other people that are going to be presenting as a part of my presentation is first Debbie Ennis-Gumberg, who's the Deputy for Innovation at MHSA, and then followed by that, you all requested an update on homelessness programs and services. That'll be done by Lisa Wong, who's currently one of our service chiefs.
Lisa Wong, yay.